I'm Hanna Marcus, and I'm currently a co-chair, as you know, of the WFPHA Environmental Health Working Group. I actually was promoted to this position after having first been an intern under the working group in 2019, and then a member, and then a young co-chair, and now a co-chair alongside Lwando and Andrea. Previously, I was working alongside Hanna, who was our prior co-chair, who led the group for several years before we stepped in. I'm based in Nairobi, Kenya. I work with an organization that does research in the humanitarian and development sector. I'm currently in Nairobi, but yeah, I still wear my WFPHA hat as well.
So I'm Lwando Maki. I'm from South Africa. I'm a medical doctor. I'm a public health medicine specialist at the College of Medicine. I'm also completing now my second specialty in internal medicine. And also I'm the co-chair of the working group with Hanna and Andrea. And then I'm also former chair of the working group for environment at the World Medical Association. And I'm the president of the Public Health Association of South Africa, and also climate lead for the South African Medical Association, and also part of the African Federation of Public Health Association, and past chair of the past deputy chair of the Junior Doctors Network of the World Medical Association, past vice president of the Young World Federation of Public Health Association, and currently a governing council member of the World Federation of Public Health Association.
I'm Andrea Rother. I'm head of the Environmental Health Division at the University of Cape Town in the School of Public Health, where I'm also a professor. And I have been in that position for many years, where we actually have 4 focus areas. So we do teaching, research, social responsiveness, and policy work. I focus quite a lot on chemicals, which Lwando referred to. So I focus quite a lot on industrial chemicals and pesticides, as well as children's environmental health and climate change. More recently, looking at the nexus between climate change and chemicals. I also do work on risk communication and risk perceptions and how that impacts on health, and looking at the commercial determinants of health, particularly focusing on the chemical industry and pesticide industry.
I think for me, I started moving towards my initial interest was in pursuing a career in the medical field, in the biomedical field specifically. I was always interested in research. I thought maybe I would want to work in a clinical context, but I think very quickly I realized that for me, the broader social determinants of health and the broader environment in which health outcomes are produced was something that I felt far more interested in and far more fascinated by than necessarily the biomedical aspects of the health field. And so I quickly kind of shifted focus towards those more social aspects of health and towards understanding the role of environmental factors in producing disparate health outcomes amongst different populations. And quickly I felt that that was my calling, and it was when I actually did my internship with the WFPHA in 2019 and had a chance to work at the intersection of climate change and health for the first time that I realized how passionate I was about specifically public health, but the environmental angle of it, and understanding how the physical environment, the role in health and well-being, both climate change and other environmental drivers. So that was kind of my path.
I've always enjoyed helping others. I think that's the first part about it. It's something you can't explain. It's very hard to keep on doing what you're doing in terms of long hours work, and also even with WFPHA, which is on top of your already hectic life, to do extra, which benefits others more than yourself. And it's a calling, and I think I do have that, and it really is enjoyable for me to do. That's the first part. The second part about it is that I enjoy learning, and I enjoy seeing how we can help improve the world. And I think, you know, of one being a clinician and seeing patient after patient come in and not stopping this flood of disease is a problem. And it's something that public health can address and prevent that flood coming in, because you prevent it from happening in the first place by doing prevention. And I think that's something that resonates with me in public health, and something that makes me enjoy keep on reading and learning more about it and doing research around public health. And then the third part relating to climate. In climate parts, it's what happened in South Africa, storms and extreme weathers happening by our border with Mozambique. South Africa has had more events, but back then it wasn't as often. We had majorly droughts were the main issue. And I saw how much the impact that those extreme events with rainfall and flooding impacted the health system in my country, South Africa, and saw how my own fellow neighbors in the African village were suffering because of these things. And at that time, the South African Medical Association didn't really have as much activity at all, to be honest. Climate, and when that happened, I just took it that something has to be done. We need to really look at this. It's impacting us, it's impacting our neighbors, and that's when my journey started in climate change. And I started becoming the climate lead, and then I started attending meetings and also representing the African voice and the African view, and also giving input to the African lens, which is very few and far, because a lot of these meetings happen in places where Africans sometimes struggle to get visas, cannot afford the flights to get there. And it was very, very refreshing for others to also hear and see us, especially in the medical and health community. And that's how it's been, and sometimes it's not always to the narrative of the global West or the higher income countries, because we have different realities and different struggles. We do use fossil fuels here because that's what we have. There's nothing else. We don't have the infrastructure for a lot of clean energy and so forth. And we need to be clear about that in terms of how we transition towards a better world and better commitments in terms of the climate, especially carbon related. Actualize some of the industrial revolution that has already happened in a lot of these countries in terms of having proper mining and proper infrastructure. We haven't actually, all our countries haven't actually really reached that as much. And we need to have that balance in how we advocate and communicate. And that's what drives me forward. And what really gets me going with what I do is representing the person in a rural village in Africa who actually doesn't have a cell phone, doesn't have even electricity, and has to fetch water from a river. I mean, that's the person I advocate for every time I talk. Actualize some of the industrial revolution that has already happened in a lot of these countries in terms of having proper mining and proper infrastructure. We haven't actually, all our countries haven't actually really reached that as much.
I started out first really focusing on, actually I was looking at women in agriculture and looking at protecting and promoting traditional agricultural practices. And I kept reflecting on what was I protecting it from? And then I got into pesticides and pesticide use, and I conducted my master's on the regulations of pesticides in Zimbabwe, the ineffectiveness of them. And then I landed a pesticide policy job with the University of Cape Town, which then morphed more and more into environmental health. And then I ended up setting up an environmental health division at the University of Cape Town, where there wasn't one before, and set up 3 academic programs. So one on pesticide, a postgraduate diploma on pesticide risk management, then a master's in chemicals risk management, and an environmental health track for the Masters of Public Health. And basically the 2 online programs, the pesticide and the chemicals one, were focused at regulators, particularly in Africa, but many low and middle income countries, to give them the capacity to be able to regulate chemicals effectively. and very much with a public health focus.
I started my work with the World Federation of Public Health Associations, and specifically the Environmental Health Working Group, when I became an intern with them in 2019. So it was, I guess you could say, around the summer of 2019 that I started connecting with Hanna, who was the chair of the working group at that time. And she was kind of guiding me on the priorities of the group and helping me to identify a project of interest, and one that would be worthwhile and mutually beneficial for the working group as well. And that was how we landed on the project that I ended up doing, which was looking at barriers to climate adaptation in the public health sector. So we conducted a national survey for that of public health representatives. That was my first opportunity to get involved with WFPHA. And then it was after that that I felt very passionate and interested in climate adaptation in the public health sector. So we conducted a national survey for that of public health representatives. And that was my first opportunity to get involved with WFPHA. And then it was after that that I felt very passionate and interested in the work of the Environmental Health Working Group. So I continued my involvement as a member, and it was in 2021, I believe, that Hanna offered me the opportunity to step up as a young co-chair at the time. She was someone that was kind of heading towards her retirement and was looking to reduce her involvement and hand over the leadership to the next generation, so to speak. And so I guess she kind of saw in me an opportunity to do that. And I know that I have a huge shoes to fill. I can attest to that from everything that Hanna accomplished in that group. Luckily, I'm not alone now. I have Lwando and Andrea, who are also amazing.
For me, being a member for quite some time with Public Health Association of South Africa, I was a member of World Federation of Public Health. So that goes, I mean, all the way back to 2015, 14, but I was never really involved at this level. And then only in 2022, I started getting active. And at the end of the year with World Federation of Public Health, through the Public Health Association. Then after that, I got involved with the Young World Federation of Public Health Association. And then after that, I was involved with the climate group. And then basically I joined Hanna in the leadership with that. And you know, and I don't think we can even, our feet combined can actually even fill those shoes even close of what they did before us. And they've done really excellently. And you know, it's been a joy to work with Hanna and Andrea. I mean, it's very understanding. Also, at the same time, it's very diligent. So yeah, that's how I got involved. And now with WFPHA, also in the leadership now in the governing council. So that's my journey with them.
We have a few main thematic focus areas, all under the umbrella of environmental health, of course, but right now those thematic focus areas have mainly included climate change, chemical regulation, as well as some work on air pollution, One Health, and just general just transition, which kind of falls under the umbrella of climate change. So we have a number of thematic focus areas and people within our membership that have expertise in quite a diverse array of different areas. So Lwando and I have been mainly leading the climate change work, whilst Andrea has been mainly leading the chemicals work. But yeah, currently we have a number of things going on. We have representation as part of the WHO Civil Society Working Group on Climate Change and Health. So basically that means that we partake in discussions alongside other civil society organizations on ways that we can kind of advocate and put forward proposals for the WHO to adopt, whether they be resolutions or official policies or other initiatives in relation to climate change and health. So we play a role in sort of advising them in that regard, or providing kind of evidence-based recommendations to advise their approach on climate change and health. So that's a group that we have membership alongside. Now, just recently, we got involved also with a working group, or more so a task force, you can call it, that's preparing the program of work for the upcoming COP conferences, COP 29 and COP 30, specifically the program of work related to public health and the public health workforce. So now we're involved in this task force that's kind of strategizing in the lead up to those meetings. So we definitely play a role in providing high level input into discussions on meetings and policy at the global level. But beyond that, we do host regular interns. We have interns do projects with us. They're often small scale research projects or small scale kind of policy reviews. We're currently in the process of updating all of our policies from the ones that we currently have, because they are quite outdated. They haven't been kind of reworked for a while. So for example, Lwando's supervising an intern who's working on that right now. I guess I can just say, as far as the objectives for the group, I think right now, or more recently, some of the big ones we've identified amongst the three of us, myself, Lwando, and Andrea, have been expanding our membership towards so that we can engage public health professionals that have a little bit of a different areas of expertise. We're trying to kind of broaden our thematic scope. And so expanding membership has been a big thing, but not just getting any members, but getting the right members that really have the right expertise in the areas that we seek to increase our engagement in. And then, yeah, of course, updating the policies has been a big one. Our policies are available to our member associations, yet they're quite outdated, unfortunately, and that's essential. It's essential for us that we get those up to date with the most recent evidence in relation to the various issues that these policies pertain to. So those have been some big objectives so far. Of course, fundraising is always an ongoing objective. We're always keen to get funds for projects because that really does open a lot of doors for us to being able to do things on a much larger scale than we can currently with limited funds. So it's an ongoing objective. But really, if you want to define the working group's overall vision, I would say it's mainly to bring voices together from the public health community, bring experts together to convene, to collaborate, to engage in dialogue around these issues, and to provide high-level input into policymaking forums and events where these issues are discussed, so that we can collectively help to shape global policy on these issues.
To add and make sure that it's clear that this is also a working group that is there to support and advise our member associations in the World Federation first and foremost, and to allow them the opportunity to engage in this climate related and be able to be informed when they're also applying their own policy-making processes and fitting it for their own countries. But everything else that Hanna said.
Climate change environmental health is a key tenet of the WFPHA strategic plan, ensuring that environmental considerations are mainstreamed into all public health policies is really at the core of what we do, and it's always been an objective of the WFPHA. Environmental health is a key tenet of the WFPHA strategic plan, ensuring that environmental considerations are mainstreamed into all public health policies is really at the core of what we do, and it's always been an objective of the WFPHA. Central consideration within all public health and policy dialogue. I think that our work on that is very critical in ensuring that WFPHA is engaging in that really important space right now, and ensure that climate change is integrated into all public health policies. So that's a big thing that I think we're doing now, but that applies to everything that we do related to the environment. Again, like I said, it all needs to be integrated, and that's always been a goal of the WFPHA to ensure.
So in terms of WFPHA itself, first things foremost, we are nothing without our member associations. So we have members in the working group from associations who contribute directly. That's the first part. The second part, because of the reputation and also the leadership that WFPHA has shown globally, we also attract people in the sector of environment and climate change who want to be part of the working group. When they join, so we have experts that come. The third one is that WFPHA is also a partner and recognized partner with WHO and other United Nations related agencies and United Nations itself, where we'll be able to attend meetings of global importance, such as World Health Assembly, such as the United Nations FCCC, which is known as COP meeting. So we get that reach. The other one is that we also have people from different sectors within the working group who also contribute to what's happening latest and up to date, and also when we have collaborations with other people, we can be able to amplify the WFPHA's work, and that's also due to the WFPHA itself, which also guides us by how other activities are happening, and also how we are going towards our strategic plan. So that's how I can say it contributes to our activities, and it allows us also to be able to get people who can collaborate with, such as healthcare.com and so forth. So it allows us, gives us access to networks, gives us also to spaces, be able to engage. We also have people who represent the WPHA attending certain meetings. COP last year was attended by Hanna. Andrea has also attended chemical meetings. So with bodies related to the United Nations. So that's how the WFPHA does also contribute to our activities and our working as a working group.
So I think we've done it in several categories. So we've done it in chemicals, we've done it in climate change, but then we've also had a bit of involvement in air pollution, if I remember correctly. We've had a group who's been active in that. And then we've also had a group active in migrant health, but were they doing anything with international legislation, do you know, or conventions with the migrant health?
Yeah, not specifically that I can recall, but I don't know if you consider plastic negotiations within the broader scope of chemicals, but that's another area that we've had some input on, I believe.
Yeah. So we've been very active in those sectors in terms of international legislation. And there's been different ways people, I think when I came in, you were talking, Lwando was talking about us attending the meetings. So many of us have been very involved in attending the meetings. We've been signatories on letters. I can't remember the more recent one, but we've joined, when there's been calls for certain things, we've joined as a signatory.
Being engaged, as I mentioned earlier, in relevant working groups or task forces that are primarily advising those, providing like advice or evidence-based advocacy and input towards global policymakers. So the most recent example I can think of from the climate change space has been our involvement with the WHO Civil Society Working Group on Climate Change and Health that I mentioned, because it was through that group that we coordinated with a bunch of other civil society actors to draft an updated policy resolution on climate change and health that we then proposed to the World Health Assembly, which convened its 77th meeting at the end of May of this year. And they ended up adopting the text that we had put forward, which means that now that's a new resolution, official resolution adopted by the WHO, and that was not to say exclusively our work, but we certainly provided input as part of the broader coalition of civil society organizations that helped draft the text for that. And there's several similar examples from chemicals policies that I know Andrea has been involved in. So yeah, I think overall there have been several channels through which we've exercised influence.
Well, I was just thinking of Liz Hanna, the work that she was doing with the Australian government as well.
Right.
Writing lots of letters and that was that air pollution?
So even our prior chair, who's from Australia. She has been extremely active in shaping Australian national policy on climate change and health. And part of her means of doing that has been getting WFPHA endorsement on a lot of her initiatives. Work with the WFPHA was kind of integrated into her work within the National Public Health Association of Australia. So for example, like Shweta Narayan from Healthcare Without Harm, she's involved in a lot of advocacy around climate justice, the need for a just transition, also plastic negotiations she was recently involved in. There was a big meeting this year in Ottawa. And for example, whenever she's involved in any of these big dialogues, she brings forward WFPHA voice as well, or she makes use of that hat, I guess you can say, to kind of increase her clout in these spaces. So we'll sign letters that her organization is leading within these negotiations. Will endorse kind of policy statements that she's putting forward, or that her group or her team are putting forward. So I think it's really a matter of all kind of coming together and just adding our voice so that we build the momentum in favor of legislative change, because often it only really happens when there's many voices backing it. So I think we just kind of add another voice that does hold some weight, given we're a global body. We collaborated with an institution based in the Netherlands that focuses on the intersection of climate change and law. And they were actually looking to develop a toolkit for public health professionals to basically utilize evidence and leverage their expertise in putting forward climate change litigation cases and bringing forward the health arguments to back those as well. And so we actually supported them in sort of basically constructing a concrete toolkit that's now disseminated and widely available to public health professionals to support their involvement in climate litigation. And the way that we supported them specifically was by facilitating a national survey that they conducted with our member associations. They actually did an online survey with all of our member associations with whom we were able to connect them. And they were able to get input that then fed into the drafting of this toolkit in the end from our National Public Health Association members. And then in the end, the final product, the final toolkit we have is kind of I mean, it really is a culmination of their work, but it does have our name on it as well, as having been involved in the research that informed it. I think personally, I can say that, I mean, as an early career professional, I don't claim to be an expert in anything, but particularly for those areas that I have maybe a little bit more knowledge or expertise, they're certainly not it's not exhaustive as far as public health goes. My areas of knowledge and expertise are within very specific domains of public health. I think that personally for me, getting input on a lot of things from working groups that work in other areas of public health, from the Federation more broadly, that has just kind of has taken more of a bird's eye level view of the public health field for years now. I think that's really helpful for me personally, because again, I'm coming at things with a certain lens, looking at it with a certain angle, and often my approach may not be comprehensive in and of itself, and it requires some voices from other working groups, not just myself personally, but just broader things that we do within the working group. I think having other public health voices involved that are not only looking at it from the environmental health angle is always helpful. And I think going back to the objectives of the working group, that was another one that I failed to mention earlier, but it's certainly been an objective of ours to increase our collaborations and our discussions and in regular dialogue with the other working groups, so that we can better integrate our activities, given they're all within the umbrella of public health, but different topic areas.
By being a working group of the WFPHA, it has opened up a conduit or an access to the World Health Association, so that we can get public health and environmental health, particularly environmental health issues within the World Health Assembly, and they're often not showcased. From my understanding, I mean, I don't have a lot of experience. My understanding is they're not showcased enough in the World Health Assembly. But through this working group and through being a World Federation Public Health Association, we've been able to have access to that.
I guess I'll just kind of reiterate the final point that I actually just made, which is related to kind of this need for interdisciplinary collaboration. I think that for me, a big objective moving forward, both personally on a professional level, but also for the working group more broadly, is to increase our collaborations with other groups. And I think that should extend not just to other groups in public health, but other groups that work in policy spheres and policy areas that intersect with a lot of the things we do. I mean, I think probably, Andrea, you're aware of the ways in which the agricultural and the chemical spaces intersect with public health, but that's not always, it's an intersection that exists, but the collaboration is not necessarily always there. And I think that it's about making those collaborations where the intersections do exist. And I think that became very clear for me, even at this prior COP conference that I visited, that I attended in Dubai in December, when I felt that as great as it was that health was on the agenda, it felt that we were sort of a little bubble. And our community was sort of an isolated one relative to the other voices there. And I felt that bubble sort of needed to be burst if we were going to really make any influence, because at the end of the day, we came with our singular agenda, but without merging that agenda with that of the other people there wasn't really going to be any productive path forward. So I think that's an ongoing area of focus for the field, for the working group, even for myself professionally, especially in environmental health. It's not a sector that you can just have the luxury of working in a silo. It's intersecting with others. So that's certainly a really important thing to always keep in mind.
Well, all the negotiations I go to on behalf of the World Federation of Public Health Association, the chemicals negotiations, they're all driven environment. So it's all,
Right.
UNEP. And in fact, often we're supporting WHO in these meetings. It's one or two people, and then us or me, depending on, who attends. But very much through the WFPHA, been able to again and again raise the voice of the health sector. So a lot of these discussions and negotiations always talk about health and environment, but all the people who attend the meetings represent environment. They're environmental focal points. And that's a problem. We've got this new science policy panel for chemicals and waste and to prevent pollution that is being developed, and it's very much being led by the environment sector. It's very important to have the profile of health and to have the name of, WFPHA behind to show that there's this support, that there needs to be much more support for health within these sectors, for these discussions.